Welcome back. In this video, we'll talk about the good and bad prognostic factors for schizophrenia. Good factors mean that these patients will likely respond to treatment and have less symptoms. Onset of the symptoms in adulthood is a good factor. And of course, if the symptoms started when the patient is young, that's a bad factor. This is another way of saying how long did the patient have schizophrenia. If the patient had the symptoms when they were young, they will have had the symptoms for a long time, and that's a bad factor. Being a female is a good factor, and being a male is a bad factor. For some reason, female patients respond much better to treatment than male patients. Having an obvious trigger of symptoms is a good factor. For example, if the symptoms start after the loss of a loved one, this is an obvious trigger, as opposed to somebody who woke up one day with schizophrenia symptoms. Having a family history is a very bad factor. These patients are much less likely to respond to treatment. The duration of the symptoms also plays a role. If when the symptoms start, the patient only have them for a couple of hours or a couple of days, that's a very good prognostic factor, as opposed to having the symptoms for a long time. And finally, positive symptoms are good prognostic factors, while negative symptoms are bad factors. And here's a small quiz. Which of the following prognostic factors is good and bad for schizophrenia? And here are the answers. Alright guys, that's all I have. Hopefully this helps, and thank you so much for watching.